My name is Dr Satchi. I'm a heart failure cardiologist. I'm really pleased to be involved in this whole programme of education. We call this heart failure, and the people that are watching this video will have had the heart failure syndrome diagnosed at some stage. And although it's called heart failure, it's a condition that can affect all of you and a lot of other illnesses that you may have. Most people with heart failure have at least 2 or 3 other illnesses that they're dealing with at the same time. The purpose of all of these education programs is to help you live the best you can with a long-term chronic condition, something that lasts for all of your life. And the videos and leaflets that we've produced will help you do that. This section is about thinking about more to do with all of you. When you have other conditions that are affecting your health, things that doctors call comorbidities, other problems affecting you, these can also get worse when your heart failure gets worse. Equally, these conditions getting worse by themselves can make your heart failure worse. And that's why it's important to look after all of you. It's important to make sure with your GP and other clinicians that all of the other conditions you have are treated optimally with the fewest symptoms that they can leave you with. And it's all important to understand what medications, treatments, lifestyle changes will help those comorbidities, because whatever you do to look after all of you will benefit your heart. Sometimes people can get a bit muddled with their medications or unclear about them, not just their comorbidity medication, but their heart failure medication. And this is very important, because if you're not sure why you're taking the medications or what medications you've taken, it's important to see somebody to get that straight. Sometimes being muddled can be a feature of other things like infection. So it's important to make sure that if you are more muddled than usual, that you see somebody about this. Infections are a common cause for people ending up quite poorly with heart failure. And in terms of what an infection symptom is, the symptom checker details this. If you do have any of these symptoms, it's important to see your clinical team. And your clinical team could be your GP, community teams like community nurses or matrons, or your heart failure team. And if they're not the ones that will be able to help you directly, they'll be able to signpost you to somebody who can help you. A lot of people with heart failure have somebody to help them, to look after themselves, take their medications, all of those kind of things. And they are who we'd call their carer. We talked about carers before, and it's important to look after your carer the way that they look after you. And if your carer becomes ill and is unable to help you, then this is something that you need to again see your clinical team about, to see firstly if you can get help for your carer, but also to make sure that your heart failure and other care is not impacted by this. Vaccinations are increasingly important. We know the flu vaccine has always been important, and as you'll be aware, the COVID vaccine is also critical. People with heart failure may not be more prone to get COVID by just having heart failure alone. However, they can become more ill if they get it, and that's why these vaccines are important. As time goes on, you may want to see your GP or practice nurse about whether there are other vaccines or treatments that you need to prevent you getting other problems. When people get heart failure, often they have issues dealing with some of these, and it would cause anxiety or depression in lots of people, and that may impact on pre-existing mental health problems. So it's important that you take your mental health seriously and that you have someone you can talk to about these things to see if that can be improved. One of the other problems that people face are financial ones and worries about benefits, work, these kind of things. So we've put together a series of things from various Department of Health websites that may help you, and these include things like the Citizens Advice Bureau. If there are other reasons that you can't take medications, not just being muddled as we discussed before, but if you have prolonged sickness or diarrhea or are feeling very unwell, then it's important again to talk to your medical team. So these are some of the special circumstances that you need to think about when you're looking after your heart health. It's important to look after all of you, mental health as well as physical and carer health, as well as your heart health.